Acupuncture analgesia, peripheral mechanism. Sensory fibers. One of the first human studies to scientifically investigate the effects of acupuncture was conducted in 1973 and tested the analgesic effects of acupuncture against morphine. Two randomly divided groups of volunteers received either acupuncture at the acupoints for Li4 and stomach 36 or morphine intramuscularly. Although both groups showed an increase of 80 to 90% in their pain thresholds, researchers found that local anesthetic injection of 2% procaine at Li4 demolished any acupuncture effect or local sensation. Another study used direct stimulation of peripheral nerve sensory fibers and acupuncture needling. It showed that both raised the pain thresholds of the subjects in a similar manner. This report not only supported the finding that acupuncture raises the pain threshold, but also revealed evidence that acupoints may be related to peripheral nerve sensory fibers. Deep tissue nerve fibers. Clinical and observation studies of the similarities of acupuncture to the peripheral nervous system led to a topographic mapping of acupoints to their afferent nerve fibers. Zhao et al. Mapped 12 meridians, including Ren meridian, with its 324 acupoints, and saw that 323 had rich innervations. It was proposed that the effectiveness of acupuncture lies within deep tissue innervations and not superficial skin afferent fibers. Volunteers in a study by Chang et al. Experienced increased pain threshold with needling at acupoint Li4. Procaine administered to the deep branches of the ulnar nerve and median nerve, innervating Li4, eliminated acupuncture-induced analgesia. However, procaine to the cutaneous branches of the radial nerve innervating Li4 at the skin did not affect the analgesia. This study suggested that deep tissue innervation and not superficial afferents at the skin level are involved in acupuncture analgesia. Muscle tissue. Other studies revealing deep tissue mechanisms of acupuncture were derived from needling technique and achieving the dachi sensation. Because of the twisting and pulling of the needle in the muscle, one proposed mechanism of acupuncture's analgesic effect focused on the afferent receptors in muscle and other deep tissues. This theory stemmed from small clinical and observational studies. 11 patients had stimulation of ST36 and subsequently experienced dachi sensation and activity on electromyography. However, both were abolished after lumbar epidural, leading researchers to conclude that acupoints had afferent muscle receptor innervation through spinal cord pathways. Connective tissue. Another theory to explain dachi lies within the connective tissue itself. In acupuncture, the sensation of dachi is described as a fish taking the bait, and this may be a coupling action of the needle with connective tissues during the winding motion of insertion. Zhang et al. Found that stimulation of acupoint ST36 generated analgesia and degranulation of mast cells. Pain relief was diminished with destruction of mast cells with disodium chromoglycate at the acupoint. Yu et al. Found similar results with destruction of the SC36 collagen fibers with type 1 collagenase. This study suggests that mast cells in connective tissues may play a role in acupuncture effectiveness. Thank you for listening.